Thank you, Chair, Madam. And it's really a privilege to be part of this particular August panel. And I would rather not go into a lengthy sort of a presentation. I'll try to make a smaller presentation. Now, when I talk about this particular topic, which has been given to us, is about the accelerating the achievement of the unfinished agenda of the ICPD and SDGs during and post-COVID-19 era through the South-South and Triangular Cooperation. Now, here I would like to say that this is what Milton Friedman said. Only a crisis, actual or perceived, produces real change. And when that crisis occurs, the actions that are taken depend on the ideas that are lying around. And that is the challenge that each of us belonging to every country in the world, we really have to find out the ideas which are lying around, take advantage of them, capitalize, and then really move ahead. I will not like to take too many time on those areas of COVID, which has been already described by my predecessors and illustrious speakers, because everybody knows that the world has gone through hell in the last 1.5 to 2 years. India has not been an exception, and we suffered some of the worst in the months of May and July. But now we are pretty comfortably placed. Our numbers are very much down to the tune of around 10,000 cases per day for a country with a population of about 1 billion, 1.3 billion to be precise. And the mortality also numbers have come down significantly. And also the advantage of having been a producer of vaccines, around 65% of our population is already vaccinated. So that's a huge task that we have been able to do. And with this, I think I would rather not talk about the COVID as such, but the linkages with the SDGs and the ICPD goals with the COVID crisis as a backdrop. So the COVID-19 has reinforced the relevance of the SDG and the ICPD goals, and the SDG agenda has accordingly been changed, and it says it presents the approach to managing COVID-19 with the objective of ensuring that now and in the future, human well-being is met while safeguarding ecological and economic sustainability. And it's very important in the backdrop of the COP26 meetings, which we had about the climate change issues that the world is facing, and also the disasters that we are really enforcing. So then what the actions now are talking about is the three prongs: that ambition, commitment, and action, and all has to act together to achieve the SDGs by 2030. And also, if you see the SDGs, it's the prosperity in a sustainable world, a world where all people can live productive, vibrant, and peaceful lives on a healthy planet, and aimed at achieving resilient health systems, healthy individuals, economic growth, better environment, equitable ecosystem. And all this, there are factors which have impacted by the pandemic, and there are factors which are important to reduce the impact of the pandemic or the disaster. So in COVID-19 pandemic, it has really helped us to identify hurdles and areas of improvement in the interaction between government policies, strategies, and actual implementation. So the COVID-19 pandemic challenges and the learnings that we have had is about the health financing. We found that says inadequate or irrational distribution, not directed towards building resilient health system. That's why the chair and somebody else and the representative from Asia Pacific, or rather the Afro-Asian, the APHO region, they mentioned about the non-availability or the irrational distribution of the money around the world being one of the curse of this particular pandemic, why we have not been able to manage it so well. There's limited integration between the SDGs and the ICT goals, which are actually interlinked, but the integration is quite limited. There is limited capacity of system across countries and states, where some countries are well ahead while the others are lagging behind. Somebody mentioned about Africa. So those are the issues that we really need to look at very closely. Then there are diversion of funds or logistics for emergency relief and recovery. This is again an area where not much could be done in the initial period. Later on, things are now moving in the right direction. But otherwise, if you see, diversion of funds and logistics was an important arm for us to really control the pandemic. Then the priority area shifted to economic development, livelihood generation. So you see, in the ICPD scheme of things, the SDG scheme of things, the sexual reproductive health was a very important one. It needs focus. But what happened during the pandemic was that the shifting of the priorities to the economic development and livelihood generation, that also has been a part that we are really contending with. So these three pillars are something which has to be the basics for any country. So in terms of coming out with strategies, and then for the strategies would lead to the policies, and then policies which result in systems. So together, these three, when they come together, the revitalization is needed, revitalization happens in the country. Coming to India's action, what did India do? So in India, in 1994, we were one of the 179 governments who really embraced a bold vision for ensuring rights and well-being in ICPD Cairo. And the same thing, what we did was we really repeated ICPD 25, India's commitment, where we said we reaffirmed our commitment and investment to sustain the gains, address the unfinished business of the ICPD, and achieve the SDGs. And with this, what we did was this stupendous achievements we have had since the ICPD 1994. Our fertility rate is around 2.2, as you can see here, is actually 2.0, which is there in the latest figures, which is going to be out in the next few days. The teenage marriage has come down to around 26.8%. This has also come down to around 18%. Teenage fertility is also reduced further than what is being shown here. Maternal mortality ratio is gone down below 113. Under 5 mortality is also gone down. So has the infant mortality rate gone down. So these are certain stupendous achievements that the country has made since 1994. India's key role in Agenda 2030 is that we are home to 1/6 of the planet's humanity, which makes the country a key player in ensuring the prosperity and sustainability of the planet and its people. So the maternal mortality ratio, if you see the global decline compared to the Indian decline, the global decline was around 45%, whereas India's decline was 80%. That's huge, more than double the global decline. And we are on that path and running very fast to reach our targets. Similarly, the under 5 mortality rates, which was actually more than the global target, has nearly caught up and overtaken the global target. So these are certain important milestones that the country has had. Moving ahead in the post-pandemic, India's story is that we have come out with a national development agenda with the SDGs and ICPD goals. And this comprised mainly of Ayushman Bharat, which means health and wellness for every Indian. So under this, what we are trying to achieve is a universal health coverage, and it strives for through establishment of 150,000 health and wellness centers by 2022 to provide universal, free, and quality primary care closer to the people. And against this promise of 2022, we have been already able to set up around 80,000 of those health and wellness centers with a footfall of about 677 million clients, which is stupendous, around 677 million clients. And India, when we talk about India, it's about numbers. So the numbers are very much over here. Second is an insurance scheme, the Pradhan Mantri Jan Arogya Yojana, health insurance cover for the poor and vulnerable families. Until death, 22.8 million admissions have been made under this particular coverage. And the one that has come up very close shortly is the Ayushman Bharat Health Infrastructure Mission. And this has an outlay of $8.6 billion US. This is already in place, and it's announced in the budget, last year's budget. And it's the largest pan-India health infrastructure scheme that aims to provide a much-needed fillip to India's capacity to address emergent public health issues. And mind you, this is not just pan-India. If you see, this particular investment is probably the highest by any country in the world for a single program. Then comes the leadership and coordination. And in that, we have the Sabka Saath, Sabka Vikas, Sabka Vishwas, which translates into collective effort, inclusive growth, everyone's trust. Attainment of the SDG goals is central to the policy goals for central as well as the state governments. Then we have the Aspirational District Program, which is an integrated strategy for focusing on health and nutrition, education, agriculture, and water resources, financial inclusion and skill development, and basic infrastructure, thus impacting the SDGs 3, 4, 6, 8, 9, and 10. So it's a holistic sort of integrated development program that we have launched around 3 years back, and the fruits are already there for everybody to see. Then also the competitive federalism that we're talking about, focusing on effective management and better results backed by data analysis, several social indices and dashboards has been developed. setting up institutional level mechanisms at the local level. So every state and union territory, and we have 36 of them, have put in place an institutional structure to take the SDG agenda forward, the review mechanisms at various levels. Coming to the last few slides, strengthening program imperatives. And this most important is advancing reproductive health, where the contraceptive basket of the country has been improved with the addition of the injectable brand of contraceptive and also a locally developed product which is called Sencromen, which is actually a contraceptive, weekly contraceptive, which has done exceedingly well as a self-care method in this pandemic. Also, we are a global leader in provision of PPI-UCD. Currently, 23% of women are covered for PPI-UCD, which is amounting to 14.7 million insertions till death. It's a huge number. There's no country which comes even second to it. Then high fertility district approach to the Mission Parivar Vikas. So we have around 146 odd districts out of our 750 districts where this particular scheme is in place, where the fertility rates are still continuing to be a little bit higher than the rest. And we are trying to have a specialized approach with a lot more strategies in place. Integrated counseling services promoted through the dedicated RM and CHA counselors. And also we have just revised our Medical Termination of Pregnancy Act. We have made it much more liberal. We are allowing this particular MTP Act actually to go up to 24 weeks. That is something very few countries in the world have done. Coming to the maternal health, we have come out with a free initiative that all services to the mother is free under the Surakshit Matritva Ashwasan, which aims to provide assured, dignified, respectable, and quality care. So every mother delivering in every public festival, everything is being paid for by the government, whether it is for a cesarean section, whether it's for normal delivery, whether it's for drugs, diagnostics, blood, everything. And also transport from home to facility, all are covered by the government. The government of India has also taken a historic and landmark policy decision to roll out the midwifery services in the country. And then we are prioritizing adolescent health and investing highly in digital health initiatives because India is a powerhouse in digital technology and we are really taking advantage of that. So the key priorities for the South-South and Triangular Cooperation, if you see, this is the last one slide, the building political commitment and leadership at the highest level, identifying the need for policy interlinkages, building capacity for formulating strategies with long-term implications, strengthening policy integration to capitalize on synergies of SRH across economic, social, and environmental goals, ensuring whole of government coordination, advocating for engaging appropriately at sub-national levels of government, engaging effectively with key stakeholders, analyzing, assessing policy impacts in various countries. So we end here with this slide with a statement by our Honorable Prime Minister. What he said is that if we want the world to be a better place to live in, we have to treat it as one unit. If you want economic growth to be pervasive, we have to make people its partners. And if you want the process of development to be sustainable, we have to work with the environment. And no, I think this particular statement is actually mostly relevant and much relevant with the situations as of today. Thank you for this opportunity and back to you.